feminist therapy. One of the things I need you guys to remember is, look, I'm teaching you. This is the eighth theory and therapy technique that we're going to have talked about. I've got a couple more to go. One of the, but I, what, I'm not trying to get you to become a Gestaltist or an Adlerian or a Rogerian or a Freudian. That's not my point. The point that I'm trying to make is that you need to be aware of this, and you need to be aware of the different techniques. And theoretically, all of them deal with kind of the same thing, but not exactly. And it's a different way of looking at things. And I don't expect anybody to become a feminist therapist. It takes years to tackle any of these, to be even marginally good at it. And sometimes it's just not going to work. It just won't fit. So, but you need to be aware of it, because when you go off to graduate school to become whatever type of counselor you want to be, one of the things, oh, okay, one, one of the things that you're going to have to remember is that you can't learn one of these things in a week. You can't learn how to be a Gestaltist in a week. It took Ellis years to develop his theories and techniques. So that's what we need to do. That we just need to be aware, and that's the reason I'm presenting them the way that I am. As I told you last time, there is one of my colleagues is pressuring me to teach you how to do these things, but you can't. I mean, it's just impossible in a week. So I just want you to be aware of it, okay? And that's the reason I want you to deal with it. I want you to get in the mindset of somebody who's a Gestaltist or an Adlerian or a feminist therapist, and this is how it would work. So you just need to be aware. It gives you a little bit more knowledge that it gives you a little bit more knowledge. Okay, so let's go ahead and get started with the feminist therapist. There you go. I've got the lady getting ready to build herself a building. Feminist therapists. Now, unlike most of the therapies, there's really not a singular individual that is that was the parent of the theory. So feminist therapists came out of the women's movement of the 1960s. Now, interestingly enough, and one of the reasons that I'm so sensitive to this is that my sister was a founding member of NOW, National Organization for Women. She started the first NOW group in Muncie, Indiana, and she started, which morphed into the one in Indianapolis where she was working. So my sister was one of these individuals. It certainly didn't start as an attempt to develop a new therapy technique, but grew out of the consciousness raising movement. One of the things that was happening before was that women were fairly oppressed and fairly suppressed. My sister was one of the first female individuals to get a law degree in Indiana. She and Dan Quayle's wife were two of the first ones, which was interesting because it was Dan Quayle's wife that kind of got him through law school. Dan Quayle was a vice president under George H.W. Bush, the older one. Such sisterhood development allowed cities around the country to reach out to the less fortunate and build shelters for battered women, rape crisis centers, women's health centers, reproductive health centers. Okay, all of these, none of these things existed before the women's movement. The women in these areas said, "We need more help. We need you to listen to us." And one of the other things that happened was they closed the orphanages and they started using foster care. And that came out of this movement as well. Female therapists began questioning the status quo that did little for the battered and raped and focused on male diseases while ignoring breast and reproductive cancers. The therapists realized that all the theories and all the therapies had been developed by white male Westerners. There were no female or minority theorists in the field, and to this day, it's very difficult to find a female therapist from the past, from the 40s and 50s. It's very difficult to find an African American. Sometimes they have to manufacture people who were African American but weren't really theoretical. They were just working in the field. The same with indigenous people. There just aren't any, and that's one of the reasons I got into psychology. My first full-time job was at Fort Belknap College, and I was hired because they needed a psychology instructor to go up to the tribe, one of the tribal colleges in Montana, in a program called MHCOP, which was Mental Health Career Opportunity Program. That was being run out of the University of Montana. It was to promote the development of indigenous social workers and psychologists. And that's why I went up there. Feminist therapists felt that psychotherapy was inextricably linked to the culture, and the culture was white, male, and Eurocentric. A central concept in feminist therapy is the psychological oppression of women and the constraints imposed by the socio-political status to which women have been relegated. And of course, it's not as bad now as it was back then. But if you ask your mothers and your grandmothers about what it was like in the 40s, 50s, and 60s, it was fairly oppressive. One of the interesting movements was the Burn the Bra movement, because women felt like they were being forced to put halters on. And of course, one thing doesn't really have a lot to do with the other. It wasn't, but the burn the bra movement was part of that whole thing. As interesting as that is, and some of these pictures, they have to do with ERA. That's the Equal Rights Amendment, which was never actually passed, was never actually ratified. But the idea was that everyone is equal and should have equality under the law, including women, because if you remember, women didn't have the vote until 1920. So there was no equality in the United States at that point. And of course, there wasn't equality for minorities as well. Our society reinforces such behaviors in women as dependence, submissiveness, and self-sacrificing. So even psychologists at the time were reading women as this is the natural way for women to be. They're dependent, they're submissive, and they're self-sacrificing. And then the men are the dominant ones. But part of that has to do with religion. Most of the major religions in the world are male-dominated. There is no equality between men and women, and as far as religion is concerned, especially Christianity. Christianity says that man should be in charge. Or at least that's the way most Christian denominations read it. Changes in psychotherapy occurred when women therapists participated in consciousness raising groups and were changed by their experiences. They formed feminist therapy groups, including non hierarchical structures, equal sharing of resources and power, and empowerment of women that could be achieved by practicing new skills and ways of being in a safe environment. And of course, this is when they started talking about the glass ceiling, and the reality was there were very few female leaders. We had some political leaders, but very relatively few. And it was like trying to break the door down to get in. It was kind of interesting. Liberal feminists focus on, and there are different types of feminists. Their focus is a little bit different. The liberal feminists focus on the helping individual women overcome the limits and constraints of their socialization patterns. These feminists tend to believe in differences between women and men will be less problematic as work and social environments become more bias free. For liberal feminists, the major goals of therapy include personal empowerment of individual women, dignity, self fulfillment, and equality. And what we're going to see is that there were different emphasis on what should be happening. And this was part of the reason that the feminist movement kind of fragmented. It fragmented because the liberal feminists said, no, this is what we need to do. And the cultural feminists said something else. And the radical feminists said something else. And the socialist feminists said something else. And one of the problems was that part of the movement was the sexual orientation. The lesbian movement, the idea of same-sex relationships, uh, that became very prominent, and because of that, it was easy. It's easy to take shots at people that have uh, strong opinions that go against society, and because of that, people would focus on that. Oh, you're a feminist. That means you're a lesbian. Oh, you're a feminist. That means you're a communist. You're a feminist. That means that you're uh, that. Uh, that you believe in birth control. I mean, it was really kind of a strange situation because politically they were trying to dismantle the feminist ideal. So liberal feminists are looking for empowerment, dignity, and self-fulfillment, as well as equality. Cultural feminists, these women believe oppression stems from society's devaluation of women's strengths. They emphasize the differences between women and men and believe the solution to oppression lies in feminization of the culture so that society becomes more nurturing, cooperative, and relational. For cultural feminists, the major goal of therapy is the infusion of society with values based on cooperation. Now, you can see that cultural feminists aren't nearly as controversial as liberal feminists. So these are the least controversial of all the feminist ideals. The radical feminists, of course, are the have extreme ideas. These women focus on the oppression of women that is embedded in patriarchy and seek to change society through activism. Therapy is viewed as a political enterprise with the goal of transformation of society. The major goals are to transform gender relationships, to transform societal institutions, and to increase women's sexual and procreative self-determination. And some of that sexual and procreative self-determination had to do with marriage. Marriage was a patriarchal idea. So the idea was if you wanted to have a baby, you should be able to have a baby without a husband. The other idea was that what was I thinking? And the radical feminists. These were some of the radical feminists were lesbian, and they believed that all sex between any sex between a man and a woman was rape. That he was taking a dominant position. It gets really confusing at this point because how in the world do you procreate without males and females? You know, that's the way reproduction works. You have to have a male and a female having sex. Uh, but the idea was that you could have a test tube baby. That was kind of the idea. It gets really confusing because my like I said, my sister was a feminist, and she wasn't radical. She wasn't very radical, but she had this argument that women should be able to do anything except physical things. She didn't mow her own lawn. She didn't, you know, the idea is okay, you don't need men, but you do need somebody with enough strength to be able to push the lawnmower. It gets really confusing sometimes. And I had these arguments with my sister. She died back in 2004, but we we had our conversations. Socialist feminists, these women share with radical feminists the goal of societal change. Their emphasis differs, however, in that they focus on multiple oppressions and believe solutions to society's problems must include considerations of class, race, and other forms of discrimination. For socialist feminists, the major goal of therapy is to transform social relationships and institutions. And you can see that it's already fragmented. So you have some women coming in for this idea, some women coming in for this idea, and it gets more and more liberal as you get into the idea. And part of the problem was they would have these listening sessions, and it would turn into an argument because the socialist feminists everybody was arguing with the radical feminists, and they wanted some wanted incremental change, and other individuals wanted change right this second. So it kind of fragmented itself because there were so many different perspectives. Gender-free theories explains the differences between male and female behavior in terms of the socialization processes, as opposed to explaining gender differences on the basis of true nature. These theories avoid stereotypes in social roles and interpersonal behavior. A flexible theory, concepts and strategies that apply equally to both individuals and groups, regardless of age, race, culture, gender, or sexual orientation. And this gets really, really confusing. Can a man be a feminist? Was part of the question. And of course, there were groups of women that like the radical feminists, they didn't want anything to do with men. They didn't want men in their organization. They didn't want men to agree with them. They wanted men completely away. They just they it was like they wanted to start a society without males in their society. So it gets real fragmented sometimes, the whole feminist movement, and that's okay. At least people are thinking and talking. Interactionist theory contains concepts specific to the thinking, feeling, and behaving dimensions of human experience and include concepts that account for contextual and environmental factors. Lifespan perspective assumes that human development is a lifelong process, and their personality patterns and behavioral changes can occur at any time rather than by being fixed during early childhood. The idea is that just because you were raised this way doesn't mean that you have to be this way all your life. Societal expectations profoundly influence a person's identity from the moment of birth and become deeply ingrained in adult personality. Gender politics are embedded in the fabric of American society. They influence how we see ourselves as girls and boys and as women and men. Traditional perspective, girls are expected to be sweet, sensitive, and docile. Boys are expected to be strong, stoic, and brave. Psychological differences between men and women are due to the fact that women are the primary caregivers who raise the children. The identity of the girls is based on a sense of continuity in their relationship with their mothers, whereas boys form their identity by defining themselves as different from mothers and by developing an identification with their fathers. Thus, girls learn from their mothers to be affiliative and nurturing and to place a high priority on relatedness and caring for others. By identifying with mothers who sacrifice their own desires and goals to serve the family, girls reduce their capacity for autonomy and independence. Boys model the aggressive, power-seeking nature of adult males and thus reduce their capacity for the expression of empathy and certain emotions. Women's sense of morality is based in issues of responsibility for and the care of other people and is embedded in a cultural context. Concepts of connectedness and interdependence, virtually ignored in male-dominated developmental theories, are central to women's development. Women tend toward relationships, whereas men tend toward separation. It is difficult for girls to maintain a strong sense of identity and inner voice, when to do so would be to risk disconnection in a society that does not honor their relational needs and desires. Feminists recognize that women are searching for a connectedness with others. In feminist therapy, women's relational qualities are seen as strengths and as pathways for healthy growth and development instead of being identified as weaknesses or defects. According to the self-in-relation theory, a woman's sense of self depends largely on how she connects with others. Women's identity and self-concept develop in the context of relationships. The core self of women includes an interest in and an ability to form emotional connections with others. Women expect that a mutual and emphatic relationship will enhance the development, empowerment, and self-knowledge of the parties involved in the relationship. The mother-daughter relationship is a crucially significant model for their relationship. Bim's gender schema theory provides another perspective on the development of women. A schema is an organized set of mental associations people use to interpret what they see. Children learn society's view of gender and apply it to themselves. Gender schema is one of the strongest perceptual sets we use when looking at society. Our ingrained gender schemas are extremely limited for both sexes. The therapists who pay attention to their own gender schemas and those of their clients can become aware of patterns and interpretations that may be hampering progress in therapy. Kashak used the term engendered lives to describe their belief that gender is the organizing principle in people's lives. She has studied the role gender plays in shaping the identities of women and men and believes the masculine defines the feminine. Because women occupy a subordinate position, they must be able to interpret the needs and behaviors of the dominant group. Thus, women have developed women's intuition and have included in their gender schema the belief that women are less important than men. Women's roles include service to others, passivity, dependency, and lack of initiative. When all human development is seen through the lens of male gender, the important qualities of both men and women are overlooked. We now have new models of development to understand women and a new perspective that recognizes that both women and men have been misunderstood. Gender stereotypes are powerful forces of social control, but women can choose either to be socially acceptable and conform, or to rebel and deal with the consequences of being socially unacceptable. To a greater degree than men, Women are expected to exhibit the qualities of warmth, expressiveness, and nurturance. They are expected to be kind, thoughtful, and caring. Many women have difficulty asking for these very qualities from others and do not allow themselves to receive nurturance. Women's traditional roles: women should not display an independent spirit. If women are assertive, they might well be viewed as being hostile and aggressive. If they display independence, men may accuse them of trying to prove themselves by taking on masculine roles. Rather than being rational and logical, women are traditionally viewed as being emotional and intuitive. The personal is political. A fundamental goal of feminist practice is social transformation, changing the status quo and improving the status and well-being of all women. Clients' individual problems have societal and political roots. Feminist therapy aims not only for individual change, but for social change. Feminists view their therapy practice as existing not only to help individual clients in their struggles, but also as a strategy for advancing a transformation in society. Direct action for social change is part of their responsibility as therapists. It is important that women who engage in the therapy process, clients and therapists alike, recognize that they have suffered from oppression as members of a subordinate group and that they can join with other women to right these wrongs. Identifying external sources of problems often results in anger, which can be harnessed as energy to take action for change. If the environment is a major source of pathology in the lives of women and men, then the toxic aspects of the environment must be changed if individual change is to occur. The goal is to advance a different vision of societal organization that frees both women and men from the constraints imposed by gender role expectations. The counseling relationship is egalitarian. Attention to power is central in feminist therapy, and the therapeutic relationship is an egalitarian one. In feminist therapy, the voices of the oppressed are acknowledged as authoritative and valuable sources of knowledge. The person in the client role is seen as having the capacity to change and to produce change. Clients are active participants in defining themselves, and the therapist is viewed as simply another source of information rather than as the best or expert source. Women's experiences are honored. Women's experiences are considered central in understanding their distress. Traditional therapies that operate on androcentric norms, that means man is in the middle, norms compare women to the male norm and find them deviant. Our society has tended to devalue subjective experience in favor of the objective. A goal of feminist therapy is to replace patriarchal objective truth with feminist consciousness, which acknowledges a diversity of ways of knowing. Women are encouraged to express their emotions and their intuition and to use their personal experience as a touchstone for determining what is reality. Women's experiences: rape, sexual assault, sexual harassment, childhood sexual abuse, eating disorders, and domestic abuse. Definitions of distress and mental illness are reformulated. Feminist therapy rejects the disease model of mental illness. Instead, feminist therapists consider intrapsychic and interpersonal factors as only partial explanations for the pain that brings people to therapy. External factors are also highly influential. Psychological distress is reframed not as a disease, but as a communication about unjust systems. Pain is defined not as evidence of deficit or defect, but as evidence of resistance and the skill and will to survive. And of course, if we look at reality therapy and client-centered therapy, we're talking about a humanist ideal, and of course, this follows the humanist ideal. That it isn't the person that is bad, it is the society that is bad. Reformulating the definition of mental illness by considering variables, symptoms are reframed as survival strategies. Women's responses to pathological environmental forces are not viewed as symptoms, but rather as creative strategies for coping with society's oppression. Learning to identify sources of pain and to express pain are crucial for the healing process. Learning to directly express internalized pain and anger, grief, and sorrow represents a basic aspect of healing because it enables clients to productively redirect emotions they have introjected or swallowed. And one of the things that we need to understand is that this isn't just for women, it's also for men, because men have accepted all these ideas as well. So men need to be helped to feel better about themselves. Using these, they can use these techniques as well, and we're going to talk about that when we get closer to the end. It sounds right now like all they're talking about is feminist therapists helping other women, but the reality is that feminist therapy can be used for men as well. Feminist therapists use an integrated analysis of oppression. Gender is an essential consideration in feminist therapy, both in the terms of oppression and in terms of differences that may influence one's understanding. Feminist therapists recognize that both women and men are affected by and raised in a culture where the sexes are differently privileged. Men who have learned that vulnerability is a weakness may have difficulty expressing emotions in and outside the therapeutic relationship. Women who have learned to subordinate their own wishes to care for their families may have difficulty identifying and honoring what they want out of therapy. Therapeutic goals. The primary goal of feminist therapy is transformation for both the individual client and society as a whole. At the individual level, feminist therapists work to help women and men recognize, claim, and embrace their personal power. Through this empowerment, clients are able to free themselves from the constraints of their gender role socialization and to expand their alternatives, options, and choices for living. Therapists help clients become interdependent, strong, resilient, and trusting of self and others. Women clients often are helped to rethink their relationship with their body. By examining the devastating effects of unrealistic societal expectations communicated by the media, women can assign less importance to appearance and focus more on pleasing themselves rather than conforming to a societal ideal. And of course, that's one of the complaints of the Barbie doll, was that it was a societal ideal that was impossible to it was impossible for women to achieve. Hopefully, look how skinny she is. She looks anorexic. Feminist therapy is a consciously political enterprise. The aim is to replace the current patriarchy with feminist consciousness, creating a society in which relationships are interdependent, cooperative, and mutually supportive. Feminist therapists work to help women and men alike recognize that how they define themselves and how they relate to others are inevitably influenced by gender role expectations. Feminists confront all forms of institutional policies that discriminate on the basis of gender. Transcendence rather than adjustment is the goal. Helping clients adjust to sexist society would only perpetuate the status quo. By achieving personal power, women are able to exercise that power to help others. The full meaning of the personal is political is that women learn to free not only themselves but all people from the bonds of oppression and stereotypes. Feminist therapists help clients become aware of their own gender role socialization process, identify their internalized gender role messages and replace them with their own constructive beliefs, understand how sexist and oppressive societal beliefs and practices influence them in negative ways, acquire skills to bring about change in the environment, develop a wide range of behaviors that are freely chosen. Recognizing the power of relationships and connectedness is also important to feminist therapists. Therapists help clients break down the isolation that women feel regarding their experiencing and help them gain a sense of their unity and commonality with other women. Feminist therapists also work toward reinterpreting women's mental health. Their aim is to depathologize women's experiencing and to change society so that women's voices are honored and women's relational qualities are valued. Women's experiences are examined without the bias of patriarchal values, and women's life skills and accomplishments are acknowledged. Specific counseling goals include help women and men trust their own experiences and their intuition, enable clients to appreciate female related values, assist women in taking care of themselves, help women accept and like their own bodies, define and act in accordance with their own sexual needs rather than another's sexual needs. Feminist therapists hold many beliefs in common with humanistic or person-centered therapists. Feminist therapists trust in the client's ability to move forward in a positive and constructive manner. They believe the therapeutic relationship should be a non-hierarchical, person-to-person relationship, and they aim to empower clients to live according to their own values and rely on an internal rather than an external or societal locus of control in determining what is right for them. They offer their clients unconditional positive regard and acceptance and strive to emphatically understand their clients' feelings and experiences. Feminist therapists do not see the therapeutic relationship as being in and of itself sufficient to produce change. Insight, introspection, or self-awareness is only a springboard to action, to free women and men of roles that have prohibited them from realizing their potential. An egalitarian counseling relationship is established. Therapy must not replicate the societal power imbalance and foster dependency in the client. The therapist and client take active and equal roles, working together to determine goals and procedures. Throughout the therapy process, the therapist is appropriately self-disclosing and consciously works to serve as a positive role model. As feminist therapy has evolved, there has been discussion about the role and function of self-disclosure. Self-disclosure should be used with purpose and discretion, just like with all other therapies. Feminist therapy rests on a set of philosophical assumptions that can be applied to various theoretical orientations. Any theory can be evaluated against the criteria of being gender-free, flexible, interactionist, and lifespan-oriented. With transformation, it is possible for feminist therapists to incorporate contemporary forms of psychoanalytic therapy, gestalt therapy, and cognitive behavior therapy in the fabric of their work. The therapist's role and functions will vary to some extent depending on what theory is combined with feminist principles and concepts. In other words, feminist therapy is not really a therapy per se. It is an idea. It's an idea that you can put with other therapies like psychoanalysis, gestalt, or CBT, or reality therapy, or client-centered therapy. But you use your feminist ideals. Gestalt therapy and feminist therapy share the goal of increasing the client's awareness of personal power. A Gestalt-oriented feminist therapist functions as a facilitator of the client's active experimentation with new roles and behaviors. the client might be encouraged to directly express previously disallowed feelings in an empty chair dialogue, or to experiment with changing her language to feel her power and become aware uh, of her options she had not considered. Contemporary Gestalt therapy stresses dialogue between the client and therapist, maintaining an attitude that there is no agenda, no desire to get anywhere, and understanding that the essential nature of the individual's relationship with the environment is interdependent, not independent. A key concept in Gestalt therapy that applies well to feminist therapy is introjection. Societal gender role messages are introjected or swallowed whole by most people. In therapy, gender role introjects can be identified so that the client can chew on them, spitting out what does not fit and swallowing and digesting that which does fit. Cognitive behavioral therapies and feminist therapy are compatible in that they view the therapeutic relationship as a collaboration, and the client is being in charge of setting goals and selecting strategies for change. They both aim to help clients take charge of their own lives. Another commonality of both approaches is the commitment to demystifying therapy. Both the cognitive behavior therapist and the feminine therapist assume a range of information, giving functions and teaching functions so clients can become active partners in the therapy process. A cognitive behavioral feminist therapist would likely employ action oriented techniques such as assertiveness training and behavioral rehearsal, and give homework assignments for clients to practice in their everyday lives. Rather than label clients' cognitions as faulty or irrational, however, feminists would help clients explore how their gender role socialization has engendered these beliefs. Therapists of any orientation can integrate their approaches with feminist principles if they infuse feminist practices in their work by conduct therapy with a positive attitude toward women, value what is feminine. They are willing to confront patriarchal societies. They're willing to empower women. They're willing to help women find their voice. A therapist of another orientation who uses feminist principles and practices is not the same as a feminist therapist. Feminist therapists have integrated feminism into their therapeutic style. Their actions and beliefs in their personal and professional lives are congruent. Feminist therapy is not merely an approach to alleviating occasional stress or resolving problems, it is a way of life for the therapist. Clients are active participants in the therapeutic process. Feminist therapists are committed to ensuring that this does not become another arena in which women remain passive and dependent. It is important that clients tell their stories and give voice to their experiencing. Initial clients may look to the therapist for answers or advice, but the therapist places the responsibility back on the clients and to relate to clients more as a person than as an expert. Clients come to trust more in their own power. The female therapist may share some of her own struggles with sex role oppression, and as an analysis of gender role stereotyping is conducted, the client's consciousness is raised. A female client will come to recognize her unity with other women and to realize that she is not alone. As she becomes more aware of ways that she has been limited with respect to the development of her identity, her self concept, and her goals and aspirations, she will begin to take on new roles. She may negotiate equality in her life, be more assertive when needed, and identify her own needs and take actions necessary to meet them. Feminist therapists do not restrict their practice to women clients. They also work with men, couples, families, and children. The experiences of a male client in therapy will in many ways parallel those of a female client. The therapeutic relationship is a partnership, and the client will be expert in determining what he needs and wants from therapy. He will explore ways in which he has been limited by his gender role socialization. A male client may become aware of how he is constrained in his ability to express a range of emotions, and in the safe environment of the therapeutic sessions, he may be able to fully experience such feelings as sadness, tenderness, uncertainty, and empathy. As he takes his new learnings out into his daily existence, he will find that relationships change in his family, his social world, and at work. Some of the themes that client is liable to deal with in their therapy: exploring anxiety and defenses, understanding power and control issues, examining external forces that influence behavior, identifying messages received in growing up, learning to accept appropriate responsibility, critically examining societal dictates and expectations, exploring one's values, reflecting on the meaning of life. Major goal of feminist therapy is empowerment, which involves a sense of self-acceptance, self-confidence, joy, self-actualization. Clients tend to gain a whole new way of looking at and responding to their world. They add that the shared journey of empowerment can be one that is frightening and exciting for both client and therapist. The therapeutic relationship is based on empowerment and egalitarianism. Women are entitled to power, and the very structure of the client-therapist relationship models how to identify and use this power. Feminist therapists clearly state their values to reduce the chance of value imposition. Feminist therapists work actively to break down the hierarchy of power and reduce artificial barriers to an egalitarian relationship by employing a number of strategies. They are actually aware of ways that they might abuse their own power in the relationship, such as by diagnosing unnecessarily. Therapists actively focus on the power clients have in the therapeutic relationship. Feminist therapists work to demystify the counseling relationship. Many feminist therapists do not use diagnostic labels, or they use them reluctantly because they focus on the individual's symptoms and not the social factors that cause dysfunctional behavior. As part of a system developed mainly by white male psychiatrists, they represent an instrument of oppression. They, especially the personal disorders, reinforce gender role stereotypes and encourage adjustment to the norms of the status quo. They lead to an overemphasis on individual solutions rather than social changes. They reduce one's respect for clients. Gender role analysis. This technique is used to help the client understand the impact of gender role expectations in her life. The therapist starts by getting the client to relate parental messages she received about her problem. By having the client reevaluate the negative messages they received, the client and the therapist are able to go over the statements and decide which ones they're going to change. Gender role intervention. The therapist provides the client with insight into the ways that social issues are affecting their problem. Power analysis and power intervention. The therapist explains the power difference between men and women in our society, empowering the client to take charge of herself and her life. Bibliotherapy. The therapist describes a number of books that address the problem that the client has. Self-disclosure. The therapist's self-disclosure not only helps to demystify the therapy process, it helps to equalize the relationship between client and therapist. Assertiveness training. This technique helps women become aware of their interpersonal rights, transcend stereotypical sex roles, change negative beliefs, and implement changes in their daily lives. Reframing and relabeling. Reframing implies to a shift from blaming the victim to a consideration of social factors in the environment that contribute to a client's problem. Relabeling is an intervention that changes the label or evaluation applied to some behavioral characteristics. An important adjunct to individual feminist therapy, group work alone is often the preferred modality for some issues that women experience in our culture. Women's groups, including self-help groups and advocacy groups, help women experience their connectedness and unity with other women. Social action, the client might decide to join and participate in organizations that are working to change. Susan is 27. She came to therapy because she is depressed. She says she hates herself for having gained so much weight since she left college, and she is certain that she is doomed to be alone for the rest of her life. She says, I missed my chance. I was popular and attractive when I was in college, but no man would ever look twice at me the way I am now. The therapist asked Susan to recall parental messages she received related to weight and appearance. Susan remembers her mother struggled with weight gain and often made remarks to Susan like, It's a good thing I captured your father when I still had a figure. You'll have your choice of men if you stay a perfect size 10. She states that she did feel attractive through her adolescence and college. The therapist does a gender role analysis on this information and moves on to a gender role intervention. Susan's therapist responds to her statement with, Our society really is obsessed with thinness. The media bombards women with the message that they need to be rail thin to be attractive. The reality is, most women don't look like models, and those who try to often end up with eating disorders like anorexia. The therapist then does a power analysis and power intervention. Susan must become aware of the power difference between men and women in our society and empower Susan to take charge of herself and her life. The intervention helps Susan learn to like herself as she is, regain her self-confidence based on the personality attributes that she possesses, and set goals that will be fulfilling to her and do not depend on whether she finds a man. Susan will be given books to read that addresses the society's obsession with thinness, and this is, of course, bibliotherapy. Susan's therapist disclosure, of course, that she too had difficulty in learning to accept her body after her pregnancy and childbirth, and that she is not a size 10 either. Susan benefits from modeling her therapist. Through learning and practicing assertive behaviors and communication, Susan increases her own power. And of course, that has to do with assertiveness training. Susan reframes her understanding of her depression and how society dictates ideal body. She relabels herself as not inadequate and unattractive because she is not thin. She relabels these things as externally derived standards. Feminist therapy can be an effective method for working with men as clients. Men, as well as women, are oppressed by a patriarchal system and can work for social change. Feminist therapists routinely work with men, especially with abusive men in battering groups. Issues that men can deal with productively in feminist therapy include learning how to increase their capacity for intimacy, expressing their emotions and learning self-disclosure, balancing achievement and relationship needs, creating collaborative relationships at work and with significant others that are not based on power. So let's get to Stan. Let's see what we can do with Stan. Stan's fear of women and his gender role socialization experiences make him an excellent candidate to benefit from feminist therapy. A therapeutic relationship that is egalitarian will be a new experience for Stan. Despite his low self-esteem and negative self-evaluations, he is able to identify some positive attributes: his determination, his ability to articulate his feelings, and his gift for working with children. The first session, the therapist establishes an egalitarian working relationship to help Stan begin to regain his personal power. It is important that the therapeutic relationship does not replicate other relationships Stan has had with significant figures in his life. The therapist consciously works to demystify the therapeutic process and equalize the relationship, conveying to Stan that he is in charge of the direction of his therapy. Stan is asked to identify gender role messages he received while growing up from his parents, teachers, the media, and the faith community and peers. He remembers how his father called him dumb and why can't you act like a man. He remembered how his parents both said that they wished that they had never had him. He remembered how he was constantly compared unfavorably with his siblings. Stan indicated that he feels sexually inadequate. He has introjected the social notion that men should always initiate sex, be ready for sex, be able to achieve and sustain an erection. Stan acknowledges that he wants to change those messages. Stan identifies a female college professor who is accomplished and strong without being domineering. Stan identifies a male youth counselor who is strong while being sensitive and nurturing. Stan acknowledges that he has been limited and constrained by his gender role socialization from his parents and society. Stan feels hopeful because people that he admires have been able to successfully combine masculine and feminine traits despite gender role socialization. Stan is given homework to read Real Boys by Pollock. And that is it. So there you go. I need you to get your stuff done. Like I said, I'm not trying to, there's no way I can train you to be a feminist or a gestaltist. I just want you to acknowledge the fact that you understand that they are different. That's all I'm looking for. So I'll talk to you next week.